Good morning, everyone, and welcome. And thank you for joining us today for the part two of our webinar on basic infection prevention and control, nursing practices for COVID-19. So last May 21, 2021, we have our part one. And we have with us Ms. Berna from NKTI who discussed the basic infection control concepts like chain of infection, the epidemiologic triad, hand hygiene, standard precautions, and transmission-based precaution. So today our focus will be on our PPE and environmental cleaning. But before we proceed to our main lecture, let us hear from our President and CEO of Qualimed Health Network, Mr. Jaime Sir Jimmy Ismael.
Good morning, everyone. Good morning to all of our viewers or webinar participants today. I'd like to welcome you all to this webinar on for all of our nurses. I think today's topic is on infection control, and we have with us today subject matter experts who can provide in all of us, as we continue to improve our practices. So I'd like to thank our team who organized this, and I would like to encourage the team to actually continue with this program because this is very important to ensure that we constantly update our nursing pool or medical practitioners with the latest trends and developments as it affects their respective roles and jobs in the network. So please feel free to participate very actively in today's session, ask the questions that you want, and take advantage of the presence of our subject matter experts in getting to know more about infection control. So again, these are exciting times for all of us. I think especially now that we are still in the midst of the pandemic, and as you know, the Qualimed Health Network has played a major role in terms of helping fight this pandemic. And by equipping all of our personnel with the right tools and insights and learnings, then hopefully that will further improve our ability to serve the requirements of our patients. And we at Qualimed now, especially now that we're part of the AC Health Network, are very much committed towards delivering quality patient care. And for us to be able to do that, it is important that we actually equip all of our practitioners, nurses, in this particular instance, with what they need so to deliver that excellent patient care at all touch points, from the time they actually check in all the way to recovery and discharge and even beyond. And that's the kind of patient experience and quality of care that we would like to deliver as we move on and with our practice. So again, thank you again for joining us this morning, and thanks to the organizers as well, and especially to our speakers and moderator for actually making this event possible. So please enjoy and please take advantage of this opportunity. And again, welcome everyone, and have a pleasant session this morning. Thank you.
Thank you, Sir Jimmy, for the wonderful and inspiring message, and thank you for always supporting us.
Thank you. Thank you very much.
So, as frontliners, it is very timely that we further hone our knowledge and skills in infection prevention and control amidst the challenges of COVID-19. Special thanks to Dr. Gina Nazareth for this opportunity, for this initiative, and to the Qualimed Health Network team for making this possible. So as I've said earlier, we had our part one on May 21. So today, our focus will be on the updates on the personal protective equipment, which we always use as healthcare providers or frontliners. And of course, the correct and proper disinfection and cleaning practices. So without further ado, I would like to introduce our speaker for today. So she's a well-rounded nurse, having been with National Kidney and Transplant Institute for almost 20 years in various capacities. So I think she has almost um, been with the different patient care areas. So, namely ER, she was an ICU nurse, hemodialysis, was also assigned in OR, and currently she is the infection prevention and control nurse at the National Kidney and Transplant Institute. Join me as I welcome our speaker for today, Miss Buenafe de la Cruz.
Thank you,
Miss Faye.
everyone. Yes, Ma'am Banji, thank you very much for that wonderful introduction. And in behalf of our infection prevention control team, headed by Dr. Raquel Victoria Ekarma, we would like to thank you, the organizers, for inviting us and letting us share our practices at NKTI. So now I'm going to share my screen. Okay. So, okay, wait. So now we will be dealing with the personal protective equipment and the environmental cleaning guidelines. Now, my outline is based on, and I wish that everyone will learn to know the proper donning and doffing guidelines, be guided in selecting proper PPE to be used in healthcare settings, and know the basic environmental cleaning and disinfection guidelines. So our personal protective equipment, or PPE, as defined by the Occupational Safety and Health Administration, or OSHA, is a specialized clothing or equipment worn by an employee for protection against infectious material. And in the hierarchy of controls, as you can see, the personal protective equipment is the last line of defense in safety controls. So, alam naman natin ang healthcare setting, if there should be elimination of the problem, yun na muna ang dapat. But then, mandated by the DOH that we cannot, avoid admission of COVID patients. So, ano po ang ating kailangan gawin? So, because of that, may surge of cases of COVID patients. Now, ano ang gagawin natin? Kasi hindi natin sila pwedeng i-avoid. So we have to then delegate some areas for the patients of COVID and non-COVID. We cannot avoid naman to admit non-COVID patients in our institution. So that comes in yung mga engineering controls natin. Will then gagawa sila, ano ang ating mga barriers, ano ang ating maganda built-in another area for them para hindi mahawa yung iba nating non-COVID patients na na-admit sa hospital. Even the traffic controls, nandyan sa kanila. What else? The admission or saan ang entrance, exit, and then ano pa ang kailangang barriers for them not to i-control natin ang kumbaga ang missing out of that patients na nakakapasok pala at nakakahalo sa ating mga non-COVID patients. Now comes in yung administrative controls natin wherein we made policies dyan with the guidance of the IPC policies natin. Okay. The guidance of policies natin. So, isusundin natin yon. Even our healthcare workers, kailangan natin na sumunod sila sa atin para sa ganon, hindi tayo mahawa din with our patients and even our co-workers. Alam natin how to control ourselves na hindi tayo magkahawa-hawa sa areas natin. Then the less effective nga is the personal protective equipment kasi as much as possible na na-control na natin yon, that malilimit natin ang pasok ng ating mga cases or yung mga infections even within our healthcare workers. Now, to those that we cannot control dahil tayo ay mga healthcare workers na nasa frontlines tayo at nasa bedside tayo. So, we need to use the PPE, but this PPE does not remove the hazard. Instead, it protects the wearer from the potential contaminants or agents. That is why in the hierarchy of controls, PPE is the last line of defense. Now, just remember that if the patient comes in and you don't know yet the case of the patient, remember to always perform the standard or remember to use or perform the standard precautions wherein you perform included in the standard precautions are the hand hygiene practices. So itong patients natin, hindi natin alam kung ano dumadating, nandun ng ating room placement kasama, and with that, kasama rin ang ating PPE. Now, while waiting for the results of the diagnosis of the patients who comes in, kasi hindi natin alam final diagnosis, just maintain the standard precaution within the patient and the healthcare worker contact. So now, pag mayroon nang dumating, alam na natin, for instance, the patient, alam mong inuubo, ano ang ating standard precaution? We need to give the patient the mask, and you also wearing a mask kasi meron kayong, alam mong inuubo siya. But once you knew the final diagnosis of the patient with after the results of labs and x-rays done, lumabas pa lang airborne precaution, anong ating gagawin? As transmission-based precaution, we need to change our surgical mask to N95 kasi alam natin na airborne precaution siya. But you cannot avoid naman the patient to remove yung mask niya dahil kung hirap siya, surgical mask is appropriate for the patient na lang instead of the N95 kasi hirap sila. As long as the healthcare worker attending to the patient, kailangan niya na yung siya mismo ang naka N95. Okay po? Now, the components of standard precautions, sinabi na nga natin kanina, it's hand hygiene, the patient placement, respiratory hygiene, and cough etiquette. Okay, now, it also, the PPE now enters. So, our personal protective equipment are the following: the gloves. So, we use the gloves for touching blood and body fluid secretions, excretions, contaminated items, for touching mucous membranes and non-intact skin. And the gown, it is used during procedure and patient care activities when contact of clothing, exposed skin with blood and body fluid secretions and excretions is anticipated. And we use masks and eye protection, goggles, face shield during procedures and patient care activity likely to generate splashes or sprays of blood, body fluid, secretions, especially suctioning, endotracheal intubation. And during the aerosol generating procedures on patients with suspected or proven infections transmitted by respiratory aerosols, we need to wear fit-tested N95 pag sa AGPs po tayo, or high respirator in addition to gloves, gown, and face eye protection. Hindi lang po yung ordinary surgical mask. Make sure po na yung ating N95 is fit-tested to our healthcare worker. Kasi kahit po sabihin mo, I'm wearing an N95 but it is not fit-tested to you, hindi mo masasabing magiging, kumbaga, effective yung paggamit mo ng N95. Okay po. Marami rin po sa atin na mayroong mga bumibili sa mga online. Yeah. Hindi po kasi natin masasabi na ito ay kumbaga guaranteed na from mismo sa company na kumbaga, approved by the FDA. So mas maganda po kung mga bibili ng mga online, titingnan nyo rin po yung manufacturer's guide, data sheets nila, kung talagang kung siya po ay officially sa mismong company na kilala. Hindi po yung basta lang. Baka kasi mamaya, may mga counterfeits po talaga tayong nakukuha. Kawawa naman po yung mga staff natin na sila yung ma-expose doon. Kaya pala nagpa-positive. Gumamit sila ng N95 but then hindi sa kanila fit tested. Okay. So there are factors. There are factors influencing PPE selection. One is the type of exposure anticipated. This is the aerosol generating procedure, one. And sometimes in a contact precaution or an airborne precaution. Now, the second one is the durability and appropriateness to the task. So, if you use, for instance, a gown, marami silang manufacturer. So, may nag-donate. So, you choose if the gown you're using is not water resistant, make sure po na yun ay gagamitin lang nung hindi ma-expose sa aerosol generating procedures na patients or with blood and body fluid secretions na exposure. Because, kumbaga, hindi niya ma-absorb pa rin po ng ating once with splashes, ma-absorb pa rin ng ating suot yung mga splashes na yon. Sayang po. So, yung durable, appropriate doon is that this kind of gown can be used po by our janitorials. Yan. Yung wala naman talaga sa cleaning lang nila, sa ating mga engineering, po pwede po yon. But sa mayroong mga aerosol generating procedures, so kailangan po fluid resistant ang ating gagamiting gown. And the third one is it should be fit to you. Now, you should use a gloves fit to you, hindi po too tight and too large for your hands para hindi yung movement mo, yung galaw ka ng galaw or matanggal man yon. So, it's contamination po is higher. And for instance, you have a gown available na talagang sakto lang sa'yo and alam mong hindi ka magiging komportable kasi hindi siya mag-fit in. So, if you have a large frame, so you can make use of two gowns. One, yung first gown mo isusot, it should be in a parang pa-jacket style na nandito ang opening. And then the second gown, you should wear it sa likod po ang opening natin. So you will feel, kumbaga, alam mong safe ka when dealing with your patient. So itatay pa rin po natin yon sa head, upper head, and then our back. Yan lang po. And make sure na yun po ay malinis. Malinis po ang ating likod and ang ating head part. Yan. So. Now, question. As long as you wear your PPE, correct or not, your safety is guaranteed. Well, this is a myth. Why? PPE will keep you safe only if you are wearing and using it according to the manufacturer's instruction and following the proper protocols on donning and doffing. So make sure din, kahit na you're wearing your PPE, nose automatic movement, hindi po. Kailangan din, alam mo, careful ka pa rin sa movement mo. Hindi ko naka-gown ka or naka-PPE ka complete ka. No, hindi po. Next, you can avoid wearing PPE if you need to do something quick. Is it a myth or a fact? It's a myth. Why? It doesn't matter how quick you can get done with a specific task. You must always wear your PPE when you work, especially when you work in a hazardous area where your health and safety are at risk. Remember that accidents happen all the time and don't have a time limit. It only takes a second for something to go wrong and an accident to occur. The more PPE you put on or don't, the more protected you are. It's still a myth. Why? Double gloving provides an easy way to remove gross contamination by changing an outer glove during patient care and when removing PPE. Yes po, hindi ang gloves lang po ang okay na mag-double tayo ng suot. Why? Because your inner gloves protects your outer gloves when removing it after patient contact. So, alam mong safe pa rin yung iyong kamay. But then, you need to use another gloves if you will deal another patient. Now, once you remove your gloves, and ang tendency doon, so malinis yung kamay mo, pero hindi pa rin naman clean yung iyong gown dahil you're from the patient. So, until you finish removing all your PPE, meron kang outer gloves, yun ang pinakalas mo, sabihin mong hindi ka pa rin protected basta marami kang suot. So make sure na yung gown mong suot or your PPE mong suot is as simple as yung yun lang, kung ano lang, hindi yung double-double po. Wala po talaga. Sa gloves lang po tayo. Okay. The more layer of PPE may make it more difficult to perform patient care duties and put healthcare worker at greater risk for percutaneous injury like needle stick injury and self-contamination during care of doffing or other exposures. Okay. And we have a study. Okay, actually, hindi naman po sa amin. But then there's a study about among 130 total sessions from 65 participants, contamination occurred in 79.2% of simulations during the doffing process with various PPE items. One is from the simple set of, there is a 92.3% and full body set, 66.2%. And among 11 follow-up evaluation participants, contamination still occurred in 82% after receiving individual feedback. But the overall contamination level was reduced. So we test also our, when during our trainings, our healthcare worker, we let them have our return demo by using the gloves and placing a germ powder powdered in their gloves, and then we let them remove it one by one. And yung napansin namin, siyempre merong konti talaga na may lumalagpas o natatouch yung skin nila. That is why kailangan po natin after removing all our PPEs, even especially our gloves, kailangan po natin ng hand hygiene for us to minimize then the contamination within our hands. Okay. Now, let's see the contamination rate based on PPE and symbol. See the PPE 1, PPE 2, and PPE 3. Okay, here is the sample. Now, in PPE 1, it is a neck to ankle overall with an overlying water-resistant gown. This is a hospital authority standard Ebola PPE set. So, level 4 liquid barrier standard po ito. Double and long nitride gloves, boots, hood, disposable face shield, and N95 respirator. A bow was tied at the lateral of the waist to minimize the risk of front contamination. Now we go to the PPE 2. It's a DuPont TVEC model commonly adopted in clinical setting to prevent Ebola transmission. So its protective clothing is also fluid resistant, but the design is one piece head to ankle overall with a zipper on the front. The whole outfit includes double gloves, boots, disposable face shield, and N95 respirator. A plastic apron was used to cover up the front zipper before use. Now we go to the PPE 3. It is a hospital authority isolation gown for routine patient care and performing AGP. So we have a neck to ankle outfit, N95 respirator, no hood, disposable face shield, water-resistant ISO gown, and shoes, and single latex gloves, using single latex glove. So do you notice? Which one do you think is more prone to contamination? So the more time-consuming process includes removing of the shoe cover, putting on gloves, and removing the outer gloves. Okay. Their study demonstrate yan. Considerable self-contamination during PPE doffing of healthcare workers. Use of the head-to-ankle one-piece overall PPEs may result in a higher contamination risk than that of the neck-to-ankle outfit with the hood covering the neck. Siya po, mas mataas. Now, we're using the PPE 3 po within our facility kasi wala naman tayong hood here in the Philippines. So, ito po yung practice namin. PPE 3. Okay. So remember that there are less contamination with the use of a neck to ankle outfit. And sometimes the poor compliance to PPE dahil sa dami ng suit natin, it's time consuming. Drink ka na sa work mo for hours and time consuming po ito. So yun. Sorry. So remember that more layer of PPE may make it more difficult to perform patient care duties and put healthcare workers at greater risk for percutaneous injury. The needle stick, self-contamination during care of doffing and other exposure. Now we focus on the PPE. First is the gloves. So the purpose of using gloves is for patient care and environmental services. Remember, when we are in patient care, we use the gloves. Pero sometimes you can see healthcare worker walking on the hallway and then touching the elevator, yung mga handrails, the door, same using of the gloves. No, sana po hindi ganun po. So, ang purpose lang natin is we use gloves during the patient care. Pero there are times that we have healthcare worker na mayroon silang wound that they cannot avoid working naman. So they use the gloves as protection from their wound. But then make sure that they change the gloves every now and then. Kasi what do we recall? That germs usually stay and multiply on hot environment, in a moist environment, hot, and then it's a closed section na yun nga with moist siya. So possible na makontaminate din yung kamay niya by maintaining the use of gloves in 8 hours. So yun po. Now in the environmental services natin, sino-sino po ito? It's our janitorials. They need also to wear gloves when dealing with other wastes and engineering controls. Pag within the healthcare setting, anong gloves ang gamit nila? Hindi naman kagaya ng gloves natin na sa ating healthcare worker. So they use their gloves, their own industrial gloves para dun sa kanilang mga projects. Now, the materials of their gloves are the vinyl type, the latex, nitrile, and others. So there we use also some also use the sterile and non-sterile. So sterile gloves are used usually sa OR setting or the procedure rooms, and the non-sterile, this is what we use in our COVID area, sa mga laboratories. Yes, we don't need to use naman sterile gloves all the time. So 1 or 2 pairs. 1 pair is enough as long as you change every patient care, every patient encounters. So, hindi lang po yung maghapon mo suot yung one pair mong gloves. You have to change it every time. Okay, single use or reusable. So, our gloves, single use lang po ito. Hindi po natin pwedeng i-reuse ito. But there are reusable gloves. Now, you will notice, ang sterile gloves, not all, are indicated for performing any sterile procedure, including but not limited to vaginal delivery, invasive radiological procedure, central vascular device dressing change, accessing implanted central venous access ports. Now, our non-sterile gloves indicated in situations when there is potential for contact with infectious material. Now, non-medical gloves may be used for food handling and some housekeeping procedures like cleaning and disinfection. So, ito po gamit nila, the vinyl type, yan, it's pwedeng ma-reuse nila. And the utility gloves, used for manual cleaning of instruments and decontamination with harsh chemicals. Most patient care activities require the use of single pair of non-sterile gloves made of either latex, nitrile, or vinyl. However, because of allergic reactions, now we use gloves made of nitrile or other materials. The vinyl gloves are also frequently available and work well if there is limited patient contact. Some gloves do not provide a snug fit on the hand. Make sure that your gloves fits you and therefore should not be used if extensive contact is likely. Remember that gloves should be fit the user's hand comfortably. They should not be too loose or too tight. They also should not tear or damage easily. Okay. Now, our do's and don'ts in our gloves work from clean to dirty. So make sure that you start using the gloves on the clean area before. Unless, if you start from the dirty, remove your gloves. Don't use it, tapos siya kapunta sa clean. Don't use it na yun. Limit opportunities for touch contamination. As long as you are performing with your patient, make sure once you goes out with the patient, remove your gloves. Change gloves in between tasks and discard inappropriate. Don't touch your face or adjust PPE with contaminated gloves. Don't touch environmental surfaces except as necessary during patient care, and don't substitute gloves used for hand hygiene. Never wash or reuse disposable gloves. Now we go to our gowns and apron. The purpose of use of our gowns is during patient care, where po, so when cleaning an area of the COVID area, syempre yung ating mga janitorials. So, sino pa po? Yung mga doctors natin na nagra-rounds, yeah. They're using the gowns and ang aprons, where do we use the aprons? So, aprons po, you wear the gown on top of the, wear the apron on top of the gown, especially dun po sa mga, those using chemicals or performing cleaning and disinfecting the chemicals like your realizers, instruments, and then for a while po. Instruments. Now, the materials we use are natural or they are or the cotton. For a while po. Sorry po. So, the natural or man-made. Natural is the cotton. Pwede po natin yan gamitin. Cotton and silk. pwedeng gamitin as material for the gowns natin as long as this is reusable or not disposable. I mean, not disposable. And the man-made is polyester. If it's man-made, pwede po natin gamitin yan na disposable naman. The reusable, yan yan, disposable. And resistance to fluid penetration. Sabihan, okay. Okay. Fluid penetration. So, the clean and sterile, the same po. Ito, items natin that the clean, pwede tayong gumamit. Clean lang po ito within our bedside and the sterile for OR. Sorry po, kasi may emergency din eh. Yun. But then, let's continue. So, the do's and don'ts in our gowns and apron. Secure gowns at the base of the neck and at the waist. Make sure gown fits securely around your wrist and gloves pulled over the cuff and discard in appropriate receptacle. Don't push or roll gown sleeves in your forearm. Never wash or reuse disposable gown and don't wear contaminated gowns outside patient care areas.
Dr. Bermudez, 101.
With our face protection, the goggles.
Dr. Bermudez, local 1017.
Okay. Protect eyes, should fit snugly over and around eyes, and personal glasses not a substitute for goggles, and anti-fog feature improves clarity. Okay. And our face shields, this protects the face, nose, mouth, and eyes. Should cover forehead, extend below chin, and wrap around side of face. So remember, okay, with our gowns and aprons, second, yeah. Our respiratory protection, remember that it protects us from inhalation of infectious aerosols. And our PPE types for respiratory protections are the surgical mask or the procedures mask. Okay. The particulate respirator, half or full face elastomeric respirators, and power air purifying respirators. Okay. PPE also protects healthcare workers from hazardous or infectious aerosols such as Mycobacterium tuberculosis. Respirators that filter the air before it is inhaled should be used for respiratory protection. So yung N95 po natin, na binabanggit natin, so it should be used for our TB cases, which is fit tested to with our fit tested po with the healthcare worker ang N95. It should be fit tested kasi nga po nawawala ang possible na magiging protected ka when you use an N95 not fit tested to you, to the staff. Okay. Now the do's and don'ts: discard inappropriate receptacle and wear properly covering nose, mouth, and chin. Don't wear it if wet or soiled. Don't crisscross ties and don't leave mask hanging on one ear. Make sure that if you're eating po and you need to remove your mask, make sure to place it in a white paper or clean paper or clean tissue. Hindi po nakahang sa atin habang kumakain tayo. Now, you can use it after, tsaka na lang po natin isuot ulit after we've done eating, tsaka lang tayo magtutok. And then, you can make use of extended of your mask by using a surgical mask on top your N95. So, pero po kung surgical mask yan, you cannot double the use of surgical mask. Yan, hindi appropriate yun. And then, kung KN95, hindi rin appropriate to use a KN95 surgical mask on top of KN95. No, hindi po din ganon. Okay. So, the most common used respirators in healthcare settings are the N95, N99, or N100 particulate. Okay. N95 and respirators might be worn by person entering the room of the patient with infectious tuberculosis. However, if a bronchoscopy performed on the patient, the healthcare provider might wear a higher level of respiratory protection. So kung meron po kayong powered air purifying respirator or PAPR, mas maganda po. But then, if you are fit tested nga po sa N95, it's okay, but as long as you have also the face shield, the minimum health standards po na given ng ITAP. Okay? Now, the N95, discard inappropriate receptacle, ensure proper fit, making sure nose and mouth are completely covered, perform a user's seal check every donning of procedure. So, seal check po, pag suot na natin siya, titingnan natin kung there's air coming out from the sides of your N95. Seal check po yan. Don't wear if wet or soiled. Don't share your N95. Don't leave mask hanging around your neck. And then don't use N95 is air leaks around the respirator edges, especially if you are assigned in a COVID area po. Kasi considered mo lang yon as yung N95 mo na may leaks sa mga sides mo as surgical mask. Okay? So now, as I am explaining about the N95, our staff need, and hopefully all of you need to be fit tested or with the N95, and our available N95 sa hospital or within you, pag na-test at you pass with the fit test, ibig lang kung sabihin you are capable or you are okay, you pass that you can perform procedures and attend to a patient with AGP, with other aerosol generating procedures like suctioning, nebulization, ayan. And our type of fit testing in our institution is the qualitative with the Bitrex. Bitrex type po is a bitter taste po available sa atin. Now, what are the respirators required for fit testing? We have the disposable of the N95 and the reusable. So the half face piece and the full piece. This is the required PPE of to be tested. Okay. So remember that if you are going to be fit tested on an N95, make sure that you have a clean shaven face po. We cannot say na magiging kumbaga hindi siya magiging maayos. I mean, the fit testing kumbaga the procedure will not be as effective kung may beard ka po. So dapat wala talaga yan. To say na kung pwede kang pumasa or pwede mong magamit yung N95 mo na fit tested sa iyo. Okay? So the sensitivity test when we do the fit testing po takes between 1 to 10 squeezes. We need to let you taste in between 1 to 10 squeezes. But in the performance of this, mas matagal po ay yung mga mas mataas ang nagiging squeezes namin kung ang employee is a smoker. So matagal nilang malasahan yung bitter taste na pinapataste namin sa kanila. So between the testing, we need to again give squeezes of 5 squeezes between tests po. So So the fit test activities we have are the normal breathing, deep breathing, head side to side, which they need to inhale at each far point, head up and down, inhale up position, talking rainbow passage or count back from 100, bending at the waist or jogging in place, and normal breathing. additional aerosol injected every 30 seconds. Ito po yung sinasabi natin. So, in between po, kahit isa lang po dyan ang sabihin nilang, we tasted something sa aming back of the throat or sa throat nila, not in the tongue. Pag back of the throat, it's okay po if you are testing the N95. Why? 95% lang po ang ating protection. So we have 5% na hindi na po protectionan tayo with the bitter taste. So as long as you taste it behind your throat, it's okay po. But once you taste it in front of your tongue, yan po, uulitin natin ang process na sa simula. Why? To make sure na mayroon, baka mamaya kasi yung fit natin ng ating N95, pag fit natin ng N95 natin ay bumaba ang ating tie on top, sa crown, baka bumaba, we will adjust first your N95 and repeat the procedure. So kung talagang you taste something, hindi ka po fitted sa N95 na gagamitin mo. So, hindi ka pwedeng mag-duty na yun ang gamit mo N95 to aerosol generating procedure patients. Pwede kang gumamit doon as long as hindi sa ganong case po. Okay? Now, their reminders, respirator wearers should not be fit tested if they have symptoms. Yes, we ask them, so may symptoms, may ibo, especially, baka may sakit sila. Perform hand hygiene before the procedure and disinfect hood and nebulizers between each fit test. Yes, we do that using disinfectant wipes. Clean the nebulizer every after use or every 4 hours. So, we conduct our fit testing every day kung sino available sa mga ating, kasi hindi natin sila mapipilit na pumunta, doctors, nurses, so everybody na na-expose, frontliners exposed to our patients, COVID patients, they need to be fit tested ng N95 na available sa ating institution. So, and the extended use and the use of respirators as part of contingency strategies. We know that there comes a time na talagang we cannot buy naubusan ng N95. So, what are our contingencies? So, there's an extended use of N95. This refers to the practice of wearing the same N95 respirator for repeated close contact encounters with several patients without removing the respirator between patient encounters. So, if you want to extend the use of your N95, so you wear your N95, put on top of it a surgical mask so that your surgical mask is the one you change it every time. So, na-preserve nyo naman po yung N95 nyo. Okay? So, the reuse refers to the practice of using the same N95 respirator for multiple encounters with patients but removing it after encounter. So, if you want to reuse your N95, for instance, you use your N95 today, you can reuse it after 5 days of quarantine. So, you need to quarantine your N95 before you reuse it. Hindi po yung today, I use it and then tomorrow I will again use it. So remember that every 5 days. But then actually, our practice is that once lang po yon. Once lang talaga namin nire-reuse yun. Kasi we don't want to, kumbaga, give the kumbaga, ma-expose pa or something na baka mamaya there's something wrong na dun sa N95 gagamitin pa. Dahil kung talagang contingency lang po na strategy yun. But then hopefully, sa ngayon naman po, marami naman ng N95 na dumadating. Extended lang po usually natin ginagamit na because of the duty hours they have, 8 hours, 12 hours. So, hindi na po. Pagkatapos na nila yun, most probably soak na yun, hindi na po natin pwedeng i-reuse yun. We now dispose it. Okay. So remember that during the extended use of guidelines, discard following AGP. So ito po yung once we use it in a patient na mayroong aerosol generating, hindi naman po natin pwedeng i-reuse yun. So, dahil AGPs ang ating ginamitan, make sure na i-discard. Discard if contaminated with blood, respiratory, nasal secretions, or other bodily fluids from patients. Discard if close contact with or exit from the care of area of any patient co-infected with an infectious disease requiring contact precautions. And the use of a cleanable face shield or medical mask over an N95 respirator and or other steps to reduce surface contamination. Yes. So, surgical mask and wear your face shield, mas protected natin ng ating N95. Okay. So, with the reuse guidelines, store in a designated area or keep them in a clean, breathable container such as paper bag between uses. So, yun po. Why paper bag? Di ba forest po yun? At least there are area of spaces na may hangin. Unlike kung plastic po ang gagamitin natin, nakukontain lang doon. So, might as well na din, may rebreather din po with the brown bag. Yun. Clean hands before or after adjusting mask. So, kailangan, yan. Don't touch as much as possible. Don't touch the front of your mask. Avoid touching the inside of the respirator, even the inside, yes. Use a pair of clean and sterile gloves when donning a used N95 respirator. Okay. The healthcare staff member can wear only N95, okay, filtering face piece respirators each day and store it in a breathable paper bag at the end of each shift with a minimum of 5 days between each N95 use. Rotating the use each day between N95 FFRs. Limiting the number of donning for an N95 FFR to no more than 5 per device. So, yun nga po. But then, our institution use only the 2. We reuse it for only 1. So, para din protection din sa ating mga healthcare worker. Kung talagang need ng may contingency. But then, they are given naman. For now, wala naman po. So they have ample supply for that, for our healthcare worker. So remember, while the contamination and reuse of FFR are not consistent with standard and approved usage, these options may need to be considered when FFR shortage exists. Follow nyo na lang po dito. And the last update is July 30, 2020. Okay. So now we go to our doffing guidelines. Now, key points about PPE. Don't before contact with the patient, generally before entering the room. Use carefully, do not spread contamination. Okay. And we should remove and discard carefully, either at the doorway or immediately outside the patient room, your PPE of gloves and your a gown. It should be at the immediately outside the patient room or the doorway or sa loob ng patient. Dapat may naka-ready na doon na what do you call this? Yellow waste trash bin for that PPE. So make sure that if you remove your PPE, huwag po yung pahagis. Kasi it might aerosolize pa yung nandoon na bacteria or germs dun sa inyong PPE. So once you roll it, make sure na pa-downward po ang ating pagtapon, hindi po pahagis. Remove respirator outside room and immediately perform hand hygiene. So yung respirator na sinasabi po natin, if you want to extend it, remove the surgical mask you're wearing on top of your respirator. Okay. So remember that contaminated area is your outside front. Yan, don't touch it. These are areas of PPE that have or likely to have been in contact with body sites, materials, or environmental surfaces where the infectious organisms may reside. So in the clean part of your PPE are the inside of your gown, outside back, thighs, on head, and back. So, yun nga yung movement natin, as with the earlier na sinabi natin, avoid natin yung too much movement na alam mong pwedeng pati ang back mo ay matouch doon sa area na nahahawakan din ng ating mga infected COVID patients. So these are areas of PP that are not likely to have been in contact with the infectious organisms unless na yung movement mo nga ay pati likod mo ay nasaya dun sa pasyente mo. Just be careful po. Okay, our PPE. This is our guided CDC PPE po for COVID-19. We have our N95 or high respirator, the face shield or goggles, one pair of clean non-sterile gloves, and isolation gown. So acceptable alternative PPE to use is the face mask over with a goggles or face shield, one pair of clean non-sterile gloves, and isolation gown. If you will observe, wala po tayong booties. Why? There are no studies na talagang infection comes from our booties or sa lower part of our body. It should be with our hands and upper part kasi this one, it touches the patients, not the lower part. Okay.
How to safely put on personal protective equipment, or more commonly called PPE.
Okay.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown, tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
Okay. Now, yan, donning and doffing. There are 4 points to remember about PPE use. First, don it before you have any contact with the patient, generally before entering the room. And once you have the PPE on, use it carefully to prevent spreading contamination. Okay? Now, how to safely take off?
How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
Okay. Remember, when you have completed your task with your patient, remove the PPE carefully and discard it in a receptacle provided. Then immediately perform hand hygiene before going to the next patient. Okay? So, additional knowledge po natin, level of occupational risk natin, very high and high. This consists po ang exposure to known or suspected severe of COVID during specific medical like postmortem, AGPs, or laboratory procedures. So ito po yung tayong healthcare worker exposed to the patient itself. So with the medium risk, those that do not require close contact with within 6 feet, ito yung even with the confirmed cases. So ito po yung mga medium risk din natin, yung ating mga healthcare workers na cleaning the area mismo, and those changing the linens. Medium risk, the dietary who give the food for the patients. So considered pa rin silang medium. And the low exposure risk is jobs who do not require contact with the people known to be a suspect of being infected with SARS-CoV-2, nor frequent close contact with the general public. So, but then we do not know kasi if the ones we are in contact with today is a negative. So, marami na po kasi tayo na asymptomatic patients na nagpumapasok pala or ano. So might as well that we wear our minimal health standards na yung ating mask and face shields in the when encountering or talking with the patient or kahit na relative ng pasyente natin. Kahit na po tayo ay low risk. Okay. Now, final thoughts about PPE. PPE is available to protect you from exposure to infectious agents in the healthcare workplace, and know what type of PPE is necessary for the duties you perform and use it correctly. Okay, now we go to the environmental cleaning and disinfection. So remember how long germs last in the environment. If you will notice, Acinetobacter, 3 to 5 months, the most common cause of the VAP ito. The bloodborne pathogens like the hepatitis, the viral infection of the liver. So 1 week din yan. The Clostridium difficile commonly found in the environment. So if we have a patient na with Clostridium difficile in their stool, might as well na i-isolate natin sila. Although hindi po namamatay ang spores through cleaning. And what does it do? Kasi ang spores is only killed through autoclave or sterilization. So ang ginagawa po nito is during the cleaning, syempre sasama ito sa ating mop ng ating mga field cares or janitors, sasama sa mop, mawawash out, and then dun natin tatapon sa mga ating water waste, tapunan. So ano nangyari po? Hindi man sila namatay, but then tinanggal natin sila, sumama sila sa water para maalis dun sa room. And even our beddings na dapat, pag kinli natin yon o malalaban yan, make sure na pag nilagay natin yan, hindi po natin ilalagay mismo sa sahig lang. Make sure na once na mag-change tayo ng beddings ng ating patient, make sure na ilalagay agad sa plastic yan. Para sa ganon, kung hindi pa nakukuha ng ating mga taga-linens or sino po ba ang nag-pick up ng mga linens natin, might as well na nasa plastic lang siya waiting for the pick up. Hindi po sa floorings. Okay? Kasi baka ma-spread pa yan dun sa inyong environment. That's why we need to contain them in a single room done with the ward po. Once your patient has a Clostridium difficile. No E. coli. So, 16 months, tinatagan. So, normally lives in the intestine of people and animals with undercooked meals. Yan. So, i-sample din ng ating Enterococcus. The Enterococcus natin sa VRE or ang ating, what do you call this? Vancomycin-resistant Enterococcus. So sample of that is the bowel bacteria. In Klebsiella species, common in gut bacteria and Mycobacterium tuberculosis. 4 months din yan. So if ever I have symptom or I have a MTB by bacteria and I am in a room, wala naman akong mask at marami kayo dito, so pwede kayong mahawa sa akin. Once I leave the room, the bacteria I left kasi hindi ako nakamask will stay in the area for how many hours pa. So once na may pumasok pa uli, he or she can acquire also that bacteria. Baka posibleng makuha pa niya yung bacteria na yon. So ang sinasabi sinasabi din natin na active MTB patient or patients natin is 1 to 14 days. So, dapat naka-secure yan or naka-isolate yan from the others. And then, once na continuous ang medication niya within that 1 to 14 days, alam po natin na hindi na siya nakakahawa. Pero, meron pa rin siyang bacteria. So, nasa isolation, pwede din po siya sa isolation dun kung gusto niyo pa rin namang ilipat. But make sure po na hindi hindi na siya okay na siya na maging mailagay sa may makasama siya sa isang kung sakali naman na ililipat siya sa ward, as long as mayroon pang surgical mask. Continuous lang po ang gamot kasi baka possible na yung ating mga patient naman is hindi siya compliant sa pag-iinom ng gamot. Mahirap din po natin makonsider na siya ay hindi infected pa. Okay, the Pseudomonas aeruginosa is common for patients who stay long in hospitals. Serratia mercensis is common from UTI, and the common skin emersal ang ating MRSA. Streptococcus pyogenes are acute pharyngitis. So, how many months ang tinatagal po nan? And if our janitorial do not actually clean the area of the patient, dapat po regular yan. How many hours ang interval nila? Pag hindi nila nalinis yan, automatic po dadami yan. So, hanggat maari po, ang ating mga janitorials are also trained on how to really clean the environment. So, in our COVID-19 surface life, there's a study na tumatagal po ito 5 days in a steel, aluminum with 2 to 8 hours, sa glass in 5 days, within 5 days, and plastic in 2 to 6 days, with the PVCs of 5 days, silicone rubber 5 days, glass less than more than 8 hours, ceramic of 5 days, and Teflon of 5 days. So remember po, in environmental cleaning, according to the CDC guidelines, the general cleaning of hospital and clinics, including the floors, walls, certain types of equipment, tables, and other surfaces are called environmental cleaning. Therefore, environmental cleaning is a fundamental intervention for infection prevention and control. It is multi-phased intervention that involves cleaning and disinfection when indicated of the environment alongside other key program elements. Yan. So, with our cleaning, this is a removal of visible soil from objects and surfaces by using soap and water. This is the first step necessary to clean the area, to remove the visible soil of the object and the surroundings. Okay. Form of decontamination na rin po ito. But then, hindi niya nalilinis talaga because without disinfection, disinfectant, so yun lang pong area na mayroong the surfaces are clean. Hindi pa rin po totally natatanggal. Okay. Now, the disinfection, the act of disinfecting using cleaning techniques and disinfectants that destroy or prevent the growth of pathogenic microorganisms. Okay. After the cleaning after the cleaning of the area, we should follow it with the disinfection. So, ang kailangan po natin, disinfection, and then i-rinse pa rin natin siya afterwards. So, ang ating pong disinfection, the mixture ng ating, ayan. Okay. Remember, that is, there's a from a 5% mixture of solution, disinfectant to a water para makakuha tayo na 1:10 dilution and 1:100 dilution. Okay. There's a manufacturer guide po on how to dilute the disinfectant. Now, we should wear gloves when the handling and preparing bleach solutions. Protective eyewear should be worn in case of splashing. Bleach solution should be made up daily. Used mainly on hard, non-porous surface because it can damage textiles and metals. So, once that you dilute the disinfectant with the water, kailangan po 24 hours lang po yun. Wala nang effect yun after. So, kailangan kung use lang po today, yun lang ang gagamitin natin, ang titimplahin natin. So, sufficient time is required to kill the virus, at least 10 minutes contact time. Yan. In a bleach solution of 1:100 small piece, okay na po yun. Now, 1:100 ang dilution natin. So, a contact time din is 10 minutes. And then in a heavy spills of more than 10 ml, it's a 1 to 10 dilution. Remember, okay na po natin, ipanlinis is 1 to 10. Hindi po nakukuha din sa amoy ng ating bleach ang paglilinis na sasabi nating malinis na ang area natin. The more you smell the bleach solution, possible harmful pa rin po sa atin yan. Hindi po nakukuha yon sa smell. Sa cleaning solution. Remember that the low risk area natin are the waiting rooms. We can clean it with a soap and water. And with the high risk, ito po yung ating heavy contamination sa laboratories, whereas patient bedside, patient care areas, we use disinfectants, even the comfort rooms. So remember, our guide po sa ating mga janitorials, they should have at least 4 types of mops that they will use daily. They should use a different mops for our room of the patient, the hallways, and those infectious cases po. So yung sinasabi kasi nating isa na sabihin natin, yung una natin sa room, this is dun sa non-COVID, sabihin natin. Iba yung map natin for the non-COVID, yes, of course. Pero kung dun sa area towels that they use in cleaning the mga taps, bed table, side rails, and the mga doorknobs, iba-iba po dapat ang gamit nila. Make sure na hindi napapagpalit-palit po ito. And that's our example, our guide with our janitorials. So high-touch surfaces, remember, we have the tables, even our computers and our computer keyboards. Yan. The sinks, the bed rails, and yan. Linens, bed linens, of course, they should be changed daily. Hindi po pwede na sabihin nila na mamaya na lang, iwan nyo na yung gamit na yan, kami na magpapalit. No, of course, hindi pwede. Why? Because if you stay the clean beddings doon sa bedside lang, naturally, pwede siyang makakuha pa ng ibang bacteria from the old beddings. So, tanggalin mo na. Huwag mo nang hayaan. Doon sine-example namin sa aming mga linen employees na sabihan nyo sila, hindi po pwede nang pag-aantayin or what. Dahil kailangan palitan talaga because of we need to remove all the contaminants in your room. Yan. Okay. Remember that high-touch surfaces are the bed rails, overbed table and controls, underside of overbed table, handles of the bed rail stand, even the toilet seat and flush handle, the sink in room and bathroom, light switches in room and bathroom, doorknobs in rooms and bathrooms, and call light button, TV remote, and telephone and chairs. So in chairs, mas maganda po if you use a monoblock chair or those not with a cushioned. Why? Cushioned, especially in COVID areas. Why? Cushioned seats po, kasi pag nilinis mo yan, i-absorb lang yan yung inyong wet damp cloth na pinampunas mo. So ano po mangyayari? Damp na yung iyong chair and pumasok siya dun sa cotton or dun sa foam ng chair. And what happen will that? So, mangyayari, yung ating mga bacteria, possible na dumami doon because there's moisture and madilim, di po ba? At mainit din ang cushion. So, possible dumami pa sila doon. Kaya po, ang mga chairs natin, mas maganda, lalo na sa COVID area, should be in plastic. Yung mga leather po natin, make sure na talagang hindi siya may wear and tear. So kailangan maayos, malinis at alam mong hindi siya may butas. Para sa ganun, alam mo na hindi pagmumulan yung chair ng mga bacteria contaminants. Okay? And avoid carpets, wala na po yan dapat talaga sa mga areas natin. Flowers, yan. So, ang mga wala po natin. Make sure na talagang i-avoid na natin yan sa ating areas. Dahil po kahit hindi sa COVID, it might be a contaminant kung siya ay nasa isang area. From outside yun room, papasok mo sa pasyente. Big no-no po yan. Okay? So, remember, in cleaning basics, clean to dirty. First, you have to clean the area where is cleaner than dirty. So, sabihin po natin sa isang room, saan po tayo magsisimula? Patient bed, surrounding ng patient bed, prior to cleaning, lastly, yung CR ng pasyente. Now, from high to low, you start from the ceiling down to the flooring. Inside to outside, so sa inside, sa room muna ng pasyente sa loob, complete the cleaning inside before you clean the hallway. So dry sweeping, mopping, and dusting. So make sure that you use a damp mop, damp towel to clean the area. Kasi we cannot clean by using dry sweeping or mopping. Okay, remove organic matter first. Remember, if we will remove organic matter on the flooring, make sure that we use only a plastic broom. No tambo is allowed in the area. Why? Because yung pong tambo, we do not and we cannot wash it. And pag you use it in a one room and then transfer to another room, posibleng maikalat mo lang yung iyong walis from one room to another. So you need to use a plastic broom to remove organic matter. So after in one room, hugasan mo yan, malilinis mo yan, madali yung matuyo, you can use it again to another room. And never mix bleach and soap. What do we mean by this po? So kung nagtimpla ka ng disinfectant mo, you don't need to put, yung pagpabango, yung downy like that. Hindi po. Soap din, pagsasabihin mo, no, nawala na po ang efficacy ng disinfectant na gagamitin natin. Okay. If we use a 1:100 solution, so yun lang po yun. After the cleaning of soap and water, followed by the disinfectant, you have to again rinse it with the mop. So wala pong mixture dapat. Okay. With my last slide, make sure that the waste disposal should be segregated. So with the black, ito po yung ating non-infectious. Make sure that an infectious also, meron siyang segregated po. With the green of, ito yung ating mga remainings na pagkain lang. So, pero po yung pagkain ko nakabalot sa Jollibee, make sure na yung foil ng Jollibee is nasa black. So, yun na remaining lang po pagkain na nandoon sa atin. Pwede po ito ang leaves and the flowers. But then, flowers, we do not allow flowers. Should be not allowed of flowers sa loob ng hospital. So with that, and adjunct to the disinfection strategies, okay, ay yung ating pong UV light, make sure that if you use an UV light, you will use a 254.7 nanometer limited to exposure surfaces. Make sure po, actually, adyang lang po ito kung paglilinis kayo prior to the cleaning. Now, You can use this, but make sure that the room is enclosed. The lightning should not pass through the door. So kung salamin ang door nyo, i-cover nyo po yun para hindi masakit sa mata ng mga dadaan. Kasi iniwasan natin yun. So yun, there is a manufacturer setting for that for 5 minutes ba, kung gaano kalaki ito. Yes, for the area, ilang minutes. Now, if you want to use the hydrogen peroxide for misting, adjunct lang din po ito. Pwede po tayo na gumamit, but then we will again, once you have finished it, doing it, magma-manual cleaning pa rin po tayo. So the best to clean the area is to do manual cleaning po. Wala pang best na makakasabing malinis po yan. Kasi kahit sabihin natin na nagmi-misting tayo, the corner of your room, hindi po talaga natin malilinis. Okay. And with that, thank you po. Okay.
Okay. Thank you very much, Ms. Pe, for that very informative lecture. I hope everyone enjoyed this amazing presentation. So, we will only have time for 1 to 2 questions. Ms. Pe has an emergency case to attend.
Sorry po kanina kasi
okay lang po. We understand po na masyado kayong busy. So, okay. So, we will be posting the materials used in the 2 webinars, part 1 and part 2, to our Facebook page and website. So if you have further questions, we will provide email address so you can send your questions. So, further end questions. So, Ms. Pe, so ako na lang muna yung mag-question. Is double gloving necessary when caring for suspected or confirmed COVID-19 patients?
okay,
So, yung po
so
ba ang standard?
the standard po actually is only 1 gloves. But double gloving actually, for the safety of our staff na rin po, we use double gloves. The first one is, yun po ang initial namin sinusuot. So considered namin na yun ang pinakakamay natin. And every time then susunod na namin, the last one to be done is the gloves, right po? It is just the second gloves. So every time we tend to add another patient, we need to change the gloves. So double gloving pa rin po. Pero as long as alam niyo po na nag-change kayo between patients ng gloves, it's okay po. Pero nga po, para lang din po ma-apis. Pero ang sa CDC po talaga, isa lang talaga. Ang nangyari po kasi sa institution namin, yes, one nurse handles how many patients? 15. 15, 12, yan. So, instead of 1 gloves lang sila pag-change, baka kasi mamaya yung mismong kamay nila ang puno na din ng bacteria. So, they need to change na yung gloves, the outer gloves, and then change another with the 1 gloves, the new gloves. Okay.
Okay po. So, for the next question, mukhang ako pa rin ang magtatanong. So, I think because ano naman to, related to part 1, so, and part 2 also. So, hindi ko natanong nung part 1 ito. Pero gustong-gusto ko talagang itanong. So, are pregnant healthcare providers at an increased risk for adverse outcomes if they care for patients with COVID-19?
Sorry ma'am, medyo choppy po kasi yung question.
Ay, okay po. Ulitin ko, ma'am.
Yes, ma'am.
So, are pregnant healthcare providers at increased risk for adverse outcomes if they care for patients with COVID-19?
So, adverse outcome po ang sinasabi nyo. For the
sabihin, are they going to have more severe case of COVID-19 if they happen to be infected?
Okay po. There are kasi ma'am, case-to-case basis. If this pregnant woman has no comorbidity before she became pregnant, so possible po hindi. But then, the risk factor po kasi na siya ay ma-expose doon, yun ang sanang ayaw natin. So, might as well, if one pregnant woman needs to go to work, wag na po natin sana Isala kasi immunocompromised na po siya, wag na lang natin i-expose pa siya to more kumbaga stressful area na magdu-duty siya. Sa non-COVID na lang po siguro mas maganda kasi bukod dun sa immunocompromised na siya, hindi din natin kung kasi halimbawa she's normal without comorbidity before the pregnancy, it's ganun pa rin po, may stress pa rin siya dahil magiging immunocompromised siya, dalawa na sila. And lalo na po kung yung with may asthma na before she got pregnant, madodoble po. The possibility of high risk talaga sila to go work on a COVID facility or area, definitely po, hindi natin masasabi na hindi siya ma-infect. Although, she can also acquire infection outside sa community, di po ba? But, yun ang gusto nating iwasan na dito sasabihin ng iba na dito nang galing because she is exposed to an area na COVID area siya. Ganun lang po, ma'am. Yun ang thinking ko for that.
Okay. Thank you, Ms. Pe, for answering those questions, and thank you for a very great presentation. It was a pleasure to have you with us today, even if you are so busy. So at this point, okay, I would like to, in expression of our gratitude for sharing your most precious time with us, we would like to present the certificate of appreciation. Let me read this. QualiMed Health Network presents the Certificate of Appreciation to Buenafe Dela Cruz, RN, for her expertise and valuable role as a speaker during the webinar entitled Basic Infection Prevention and Control Nursing Practices for COVID-19 Part 2, given this 4th day of June 2021 by a Zoom virtual event. Signed, Maria Gina C. Nazareth, MD, Vice President for Patient Safety and Quality Management, QualiMed Health Network, Manuel Francisco T. Rojas, MD, Senior Vice President for Medical Affairs, QualiMed Health Network, and Mr. Jaime E. Ismael, President and Chief Executive Officer of QualiMed Health Network. Again, Ms. Pe, thank you very much for sharing your time with us.
Thank you.
Okay.
Pleasure, ma'am. Thank you.
Sana maulit-ulit. Okay. For better dissemination of information discussed in this lecture, a video recording of this webinar will be available in all nursing units, including specialized units. And it will also be available in our Facebook page. Okay, so this concludes our webinar for today, the part 2. Thank you all for attending, and I hope that you will be able to apply all the knowledge gained from this presentation. So please, I know that there will be more webinar series that will be presented to us by the PSQM of QualiMed Health Network. So again, thank you very much to Dr. Gina Nazareth for this initiative, and to the team of QualiMed Health Network for making this possible. And also, Ms. Pe, thank you very much. Ingat po kayo lahat, and hopefully we will see each other again in the next webinar. Thank you, and have a good day, everyone.
Bye-bye.
Bye po.
Thank you po.
Thank you.
Thank you po.
Thank you, Miss Day.
It has been months since we started our fight against COVID-19. Throughout these tough times, our healthcare teams have learned to embrace the challenges, making us stronger and more resilient against the disease.
Good day. My name is Dr. Lilibeth Maravilla, and I'm your doctor for today. Let me walk you through our new normal inside a QualiMed Health Network facility. But first, let's all wear our face masks and face shield.
Our facilities are compliant with the national and international infection prevention and control protocols. However, infection control and patient safety has become more critical now more than ever. This is why our experienced team of safety officers, together with our infectious disease doctors, are working even harder to formulate, implement, and monitor updated and relevant safety protocols and policies. Before entry to our facility, all individuals must be screened and must submit a health declaration at our primary triage areas. This is whether you're a doctor, a healthcare worker, a patient, or a designated companion. This is to make sure that patients with symptoms are not allowed entry to our non-COVID zones. Persons with symptoms must be screened at the emergency room triage prior to entry. Inside the facility, physical distancing is strictly enforced in compliance with the international infection control protocols. Hand hygiene stations and disinfectants are available all over the facility. This is to encourage everyone to wash hands and disinfect as often as possible. Routine cleaning and disinfection is part of our infection control protocols. We disinfect in between patients and procedures everywhere in our facilities.
We do it regularly, but feel free to do it too. Remember, clean hands are safe hands.
As part of our new normal, patient can now avail of our online doctor consultation through telemedicine. However, if face-to-face check-up or a procedure is requested, you may set an appointment with an outpatient visit so our healthcare team can serve you as needed.
Our doctor's clinic are now open for consultations. We have various subspecialty holding clinics, including our industrial and occupational health clinic, which serves both corporate and outpatients.
Don't forget to secure an appointment prior to your visit. This is to make sure that we are able to control the number of patients within the hospital at any given time. Inside our facilities, our COVID and non-COVID areas are strategically and physically separated. Some facilities are isolated through air exchanges and some through negative air exchange equipment. This is to make sure that air is contained within the COVID areas, keeping our non-COVID areas safe from possible contamination. We also have walkways and elevators exclusive for COVID-related cases. Our COVID-related zone, which we call Area 19, has operating room, isolation areas, intensive care unit, and other services exclusive for COVID-related cases. We have admission rooms exclusive for COVID-related cases in Area 19. To better protect our healthcare teams, our Area 19 is also equipped with the donning and doffing area and with our compliance officers so our workers can safely and properly wear and remove their personal protective equipment. As a recent addition to our capabilities, each of our hospitals now has a molecular laboratory. This provides COVID-related testing such as RT-PCR test. For better containment of infection, our RT-PCR laboratories are located outside our hospitals. With this service, COVID testing is now more accessible to the community we serve, providing better monitoring and control of the disease. For admissions and surgery, we require all patients and their companion to undergo RT testing. This is to help ensure that our non-COVID areas are safe from possible infection from our patients. Our healthcare workers also benefit from our own COVID testing capabilities. With risk-based COVID testing, we are able to control infection in our team, making services and operations safer within our facilities. We do this because we believe that our healthcare workers need to be well so they can serve you better and safer. We're doing all we can to implement ways and means to keep you safe in our facilities.
Always remember, when your safety comes first, your wellness follows.